Okay, go ahead.
So as I mentioned, I'm going to talk about writing your project plan, and then Mary's going to talk about your evaluation plan. And so for today, to illustrate writing the project implementation plan, we're going to use the case study of our overall goal is to increase colorectal cancer screening rates through high quality implementation of the evidence-based flu-fit program. What you see here is you're naming an evidence-based intervention, which is the flu-fit. So you want to make sure in your proposal you name an evidence-based intervention, and we talked about that last time, and that you also are going to be writing an implementation project plan where you describe how you're going to implement that evidence-based intervention. The intervention may be one part of an overall plan that you have. All right. So another way of saying this is you want to make sure you're building on the evidence by selecting an evidence-based intervention or effective intervention, but you also want to use your project plan to describe the steps you're going to take to implement that change in practice. So we're going to be talking about 4 steps in your project implementation plan. And those, we're going to go through each of these one at a time. The first is you want to establish a team, which you can call a project team or an implementation team. You want to think about what you need to do to get ready to implement. Then you want to create your project implementation plan. And then we're going to talk just a little bit about the importance of communicating with your key stakeholders throughout your project. So as you think about creating your team, and so in your proposal, you're going to describe who you're pulling together to do this work. And so think about who are the key people you need to have on your team. What are their roles going to be? Ultimately, you're going to want to have a regular meeting time and be thinking about how to engage your stakeholders to support the team. So there's a tool that was sent to you with the handouts that can be helpful to just put on paper what your overall aim is, what your measurable objectives are, or your SMART objectives for this project. And those SMART objectives are a very important part of your proposal, by the way. Then who is going to be on the team and what roles they're going to have, when and where the team's going to meet, who are the stakeholders that you need to keep engaged. And then you can either, if you do work within a setting, get your senior leadership to sign, or you can get the members of the team to sign. And this provides a clear understanding of what we're all agreeing to work on. So just a reminder, the overall aim is to increase colorectal cancer screening rates through high quality implementation of the evidence-based flu-fit program. Within that, you're going to have specific SMART objectives, measurable objectives. In this case, you're going to, in your proposal, say, for example, we're going to provide a FIT testing kit, which is a colorectal cancer screening test kit, and recommendation to at least 80% of patients who participate in the September flu clinic and are due for colorectal cancer screening. So you can see that you have a time specified, which is the T in SMART. It's measurable, which is the M. I should do this in order. It's specific, it's measurable, it's achievable, it's realistic, and it's time oriented. Your second bullet is similarly, at least 75% of those patients will return a FIT kit, and 100% of patients with a positive result will get follow-up diagnostic testing. And this is just an example of who you might include. This is a clinic-based, and I know most of you are not doing clinic-based work, necessarily, but this is the example we're using. So in this case, your team members might be your quality improvement specialist, your clinic manager, your clinic nurse and medical assistant, and you've determined when you're going to meet. Okay, next. The next is to think about, okay, we now have a plan, we now have objectives. What do we need to do to get ready to implement? And so we have included with your handouts a checklist that you can use just for brainstorming, for thinking about what will we need to do before we can even start to implement. And so here are some examples of some of the things to think about. Do I need to make sure leadership supports? Have we identified staff to deliver the intervention? Do we have plans for educating and supporting staff? What space, equipment, and materials are needed? Do we have a plan for recruiting patients? So once you've done your readiness assessment, you've identified some areas where you need to do a little bit of work. You need to get the leadership support, you need to plan for educating and supporting staff, and you need to develop a plan for recruiting patients. All of these steps can go into your project implementation plan, which is the next step, is to create a project implementation plan. And to create the implementation plan, review your goals and objectives, review information about the evidence-based intervention, review your readiness assessment. And then once you've done that, you can make a list of everything you need to do, both to prepare to implement and to actually implement. So make your list of tasks and then think about a timeline for when those tasks need to be completed, and then figure out who's going to be responsible for each task. The responsible person isn't always everybody who's involved in doing the task. It's more thinking about where does the buck stops here? Who's the person who's actually going to be responsible? Then once you have these, you can create your project implementation work plan. And in the things that were sent to you is a template for a plan. This implementation plan is a key part of your proposal. It's where you tell us exactly what you plan to do and when you plan to do it in order to complete what's required to prepare for and implement your evidence-based intervention. So this is an example for our flu fit program that we're implementing. Prior to implementation or pre-implementation, what needs to be done? We are going to create a system to flag patients due for screening in the electronic health record, or EHR, put down the date by which it's going to be done, and the person who's overall responsible, in this case, it's the information technology or IT person. We need to purchase the fit kits. And again, you have a due date and a person responsible. We need to develop and pilot test the fit kit instructional materials. Make sure our participants understand the materials in the kits and can actually follow through on them. We need to create and pilot a log for tracking fit kit distribution and return, etc. After you do the pre-implementation, then you start on the tasks that are required to actually implement the EBI. And then the final thing I'm going to talk about is communication. And I think this is maybe one of the most important parts of implementing a change in practice. And I'm sure from your experience, you have similar value of this, is you will be most successful when the people on your team and other people that you work with know about the work you're doing and the what you're trying to accomplish. So we all have a tendency to be this little face in the red square. I know that I do, that we live in a world where we're overwhelmed with information and things to do. And that is true of all of your people you want to engage with what you're doing. They are all overwhelmed. And so you need to make sure your project stays front and center. And the way you do that is with communication and thinking about what simple things can you do to keep this on people's radar, so that their energy and attention doesn't shift to another intervention or the latest crisis, but also they keep some part of their energy and attention on what you're trying to do. So thinking about who are your key partners that you want to keep engaged. It might be your leadership. It might be healthcare providers who you want to have. It will be different for whatever you're doing, but for the flu fit, we want to keep leadership, healthcare providers, co-workers who will assist with flu fit implementation delivery, patients, and potentially others. We want to keep them aware of this and engaged with us. Next. So just some ideas. It does not have to be complicated or resource intensive. For leadership, you may want to schedule a one-to-one meeting. You may post something on a bulletin board, include an article in your organization's newsletter, create a flyer and post it. Ask to be on the agenda of an upcoming meeting that's already happening, to do like just a 3-minute update on how things are going, so that you're keeping this on people's radar. You can also use social media. Are there any questions about the writing the implementation project plan? All right, I think I'm going to turn it over to Mary. Oh, I forgot this slide. Just a reminder that as you're planning for implementation, the websites we went through last week often provide materials that may be helpful. And so make sure you're going back to check to see if there's any guidance there or materials there that might be helpful to you. All right, so Mary.
All right. So now we're going to talk about writing our evaluation plan. So before we get started, I thought we could talk a little bit about why it's important to conduct evaluations. Evaluations can be a way to track your progress, and it also can be a way to inform your partners or stakeholders about your progress as well. The evaluation report might be something you update your partners on in the little meetings that Jennifer talked about. Evaluation data can also be used to improve your project, and it can help you see if your project's making the desired impact. So I'm going to talk about 5 steps today to writing our evaluation plan. The first step is to outline what you already know, such as your program activities and goals. And then using that information, we'll write evaluation questions. In step 3, we'll talk about how to decide what to measure to answer those questions. Step 4, we will discuss gathering evidence to answer those questions. And then last but not least, we'll briefly talk about how to share and use your findings. So the first step is to list your program activities and goals. And these items highlight what you set out to do when implementing your program, and therefore are a good place to start when you're thinking about how you'll evaluate your program on its implementation and its effectiveness. So here we have a list of a few activities from our implementation plan that are a part of the FluFit program, starting with distributing fit kits to eligible patients, moving all the way through the process to communicating the results back to patients. So these FluFit activities are basically leading us towards our goal, which was to increase colorectal cancer screening rates through high quality implementation of the evidence-based FluFit program. So once we have all of our activities listed out, next it's time to think about some evaluation questions for each one of those activities. Basically, when you're thinking about your evaluation questions, you want to think about whether or not you did the activity, and if the activity that you did helped you achieve the outcome that you wanted to achieve. Other questions that you can think about when thinking through evaluation questions are, is this activity being implemented as planned? Is the intervention feasible and acceptable? Are you reaching the patients that you intended to reach, especially those at greatest risk? Are you reaching other audiences, perhaps providers or policymakers? And then when it comes to evaluating any impact that you made or your outcomes, you might ask, do behavior, knowledge or attitudes change? Do cancer screening rates improve? Do cancer-related mortality decrease? So there's a lot of different ways that you can look at it. And these questions will definitely vary for you depending on what your intervention and your activities are. So that's why it's important to keep in mind those questions or in your activities. But looking here at our activities, can anyone think of what you might write for an evaluation question for our first activity, distribute kits to patients? You can type it in the chat or come off mute if you have any ideas.
What was your question again?
Sure. What would be an evaluation question that we could write to help us understand if we've achieved our first activity, distribute kits to patients? Were all the kits distributed? Perfect. That's a great example. How about for collect return kits from patients? We can probably think of something similar, like how many of the kits that we sent out were returned. And the same goes for the communicate results. So here are some that I came up with, very simple evaluation questions. So for the first one, how many patients receive fit kits? You could even ask how many patients out of all the eligible patients received fit kits. For collect return kits from patients, how many distributed fit kits were returned? Communicate results, how many patients were notified of the results? You may even take that further to say how many patients with a positive test were referred for follow-up. And so these are examples for FluFit, for colorectal cancer screening, but you can do a similar thing for your own activities in your plan, thinking about whether or not you did the activity and if the activity achieved your outcome. So the third step, you'll want to start thinking about what you will measure to answer each of these questions that you wrote in step 2. So here again, I have some examples in my table. So for the first activity, for the first question, how many patients receive fit kits? We might measure it simply by counting the number of people who received kits and comparing, dividing that by the number of people who are eligible to get kits, so we can see how many we reached. And so on with the rest. So how many distributed fit kits, number of kits returned out of the number distributed. So you want to think about like how you're going to actually kind of quantify and measure something that shows you that you completed that activity. So here's another example that we can use for some practice. This is our evaluation question. Let's say, what barriers are patients encountering to completing and returning the fit kit? This is what you want to know as part of your evaluation. So how would you answer that question? What would be some data that you might need to collect to measure this and answer this question? So if you want to know if patients are encountering barriers and what kinds they are, who might you talk to or who might you go to? Surveys from patients, yes, exactly. So you might measure patients' perceived barriers by asking them in a survey or an interview. And so this evaluation question is an example that now all the data that you'll collect to measure will be numbers and rates like we talked about with the fit return rates, but they might be qualitative data from interviews. Transportation to bring samples back. So you can also, observe different barriers based on whether or not they're returning kits and what they say their problems are for returning them, if it's transportation. Yeah, so there's lots of ways, and this, I just wanted to kind of give you an example that it can be more of a qualitative type question too. So now we're going to jump right into an activity. I'm hoping, since the proposal is open today, that some of you have been giving some thoughts about what you want to propose, what your project might look like. It's okay if you haven't, but if you have, think a little bit about what some evaluation questions you might include to evaluate if you've completed the activities, or if your activities in your plan have made an impact. So I'm going to give you a few minutes to just kind of think about it and jot something down if you want. And if anyone would like to report back and share, that would be really fun. But go ahead and take just a couple minutes. If someone's ready and has something to share, go ahead and raise your hand or something. We can keep going. If you have questions too while you're thinking, please let us know. Okay, so Nora, I see you have something in the chat. Do you want to talk a little bit about your project idea and what this activity might be, what this evaluation question might be looking at? It's okay if you don't want to.
Well, we've done a lot of activities, and I think, and one of the ways we do is we get a data back from the hospital,
Mm-hmm.
the number of women who went. The one thing that I would like to get in the future is, why were some of the women denied service?
Yeah. Okay, so that would be your evaluation question. What kinds of data could you collect to find that out, or how would you collect that data?
Well, we could go to the women themselves, because they do fill out a form for us. So I have their contact numbers, and that's what we do. We call them to say, what was the issue?
Mm-hmm.
And that's when we find out what barriers existed that prevented them from getting mammograms.
Yeah, that's a great example. And so you could potentially create some sort of questionnaire to ask your participants. And if you're able to find out what their barriers are, you might be able to modify your program to address some of those barriers. So that's a really great example. Does anyone else want to share an example from their project before we move on? Thank you, Nora. Okay. All right, so now we're on the fourth step. So now that we know what questions we need to answer and how we'll measure them, we need to think about ways that we can collect the data related to those measures. So we already started to touch on that a little bit with Nora's example. So first, you could try looking for existing data. You might talk to your partners to identify if there's already data being collected. For example, they might have that data in the EHR if you're in a clinic setting, or on tracking logs. In the first module, we talked about different sources of data. You might be able to use some of those sources of data, but they're probably more useful for a long-term evaluation, and a little harder to use for short-term evaluations, because those data are reported annually or even less frequently, and so they might not be current enough. So if there's no existing data available that will work for you, You'll also want to look into existing data measurement tools like surveys or tracking logs that you might be able to use to collect data for your own. If those tools don't exist, you also can create your own data tracking logs and tools. So we'll talk a little bit more about different ways you can collect data in the next few slides. And it might be helpful too to create some kind of a plan for and include this in your evaluation plan, a plan around how you'll collect your data, who will collect it, and when and how often it'll be collected. So here's our table again, and we're just adding another column here so that we can include our data source. So in my example, you can see that maybe the data source is a FitKit tracking log, an EHR, reports from the GI clinic. In Nora's example, maybe it's conversations like transcripts or recordings or notes from conversations with patients. So it's good to think of, like, now that you know what you need to find out, how are you going to get that information? Where is that data going to come from? Next, you'll also want to include the frequency in which you'll collect the data. It might be monthly, or it might be one-time pre-program and post-program. It's also helpful to include who's responsible for collecting the data. Here I have staff nurse. On your plan, you'll want to be pretty specific and include the name and the role of the person who's responsible. You can also make your own table like this using the evaluation plan template that we included in the handouts. So in the first session, we talked a lot about conducting interviews as a way to collect new data. You can use some of those same data collection methods for your evaluation data as well. So we've talked about tracking logs, surveys, interviews, focus groups, even simple meetings or observations are all different ways. I'm going to briefly touch on a few of them here in the next few slides. Yeah, so tracking logs. Tracking logs are very helpful and a straightforward method that you can use. You might create a tracking log in Excel or even just on a paper tracking log and use it to track when a series of steps in a process are completed. So I imagine many of your projects have a list of things that need to happen or something that you might be able to track. In our FluFit example, we might track reminders to get colorectal cancer screening, completion of screening, or referrals for diagnostic colonoscopy. And you can include information like the dates, the number distributed, who it was distributed to, and it can help you keep track of whether or not you're implementing your program the way you intended, and that things are working and you're able to achieve the activities that you set out to achieve. Surveys can be a way to collect data as well. And a few examples, you might mail or text a survey to patients to assess their satisfaction if that's going to answer one of your evaluation questions. Maybe you'll email clinic supervisors to assess if and how new screening tests were implemented. Lots of different ways. Surveys might be a little more difficult if you have a small group, because it can be kind of hard to generalize to the population and get context around what people want to say about the program. So another method to use that might be more helpful for evaluations is qualitative methods. These can help you answer your evaluation questions with more, anecdotes and quotations that can kind of bring your outcome data to life a little more. So for qualitative data collection, it could be just interviews or informal meetings with your partners, with the participants in the program, or they might be more group meetings, focus groups, that type of thing. You might ask staff about their experience delivering an intervention, or you might ask the people who received the intervention for feedback as well. Another way to collect data is through direct observation, which is a process of documenting activities or characteristics of an environment that you can observe. So you might create a checklist that includes different characteristics that you're looking for. So maybe I'm just guess thinking of an example for flu fit, maybe one of your activities was to change the waiting room around and include some advertisements. So you might do an environmental scan with your checklist of your waiting room to see whether or not there's the CRC, the colorectal cancer screening advertisements or something, for example. So you might, so there's different ways that you can kind of collect data and understand whether or not your activities are being completed using just observation. And if you have a lot of sites that you're working with, you might be able to do this just at a couple sites to get a general idea how things are going. And this data can also help you determine if you implemented the program the way you intended, or in other words, delivered the intervention with fidelity. So now we're on our step 5 for evaluations. You want to make sure that you are able to use and share your findings. So this is something that's helpful to think about from the start. As you're creating your evaluation plan, you want to think about what you want to know and how that data will be helpful, how you will use it. So most likely you'll be able to use the data to improve your program in the future. The data is also important to share with your partners and stakeholders so that you can let them know how things are going. If you share your data to a broader audience, it can be helpful. If other groups want to implement the same program that you did, they can learn from you. And then lastly, just make sure to think a little bit about your audience and the format. There's a lot of different ways you can share your results back to your partners, and it might vary. So like, for example, in an evaluation that I was a part of recently, we shared data in peer-reviewed manuscripts, abstracts, but we also shared data in simple data briefs with the clinic staff, or we created like presentation slide sets that they could then use and share back with the rest of their clinic coworkers and leadership. So there's lots of different ways to share your data depending on the audience. Okay, and this is a little bit outside of the evaluation plan and the project plan, but we wanted to briefly talk about the last proposal component, which is the budget. You want to make sure that your budget covers what you describe in your project plan and evaluation plans, and all parts of sorry. The key sorry about that. I'm almost finished here. The take-home message is that all parts of your proposal should speak to each other. So that is everything. We've completed all parts of our training. I want to take any questions that you have in a second. I just also want to remind you all that the proposal is open today. You'll be getting an email about the post-evaluation survey at 1 o'clock. And we'll go back to my question slide. We can use the rest of the time to take any more questions about evaluation or your project plan, the proposals, any questions that you have, other parts of the training. We have some time.
I also want to encourage folks to reach out to us if you have any questions as you're writing your proposals. And I think is the best way for them to get a hold of us to email you, Veronica, and then you can connect them with us.
Absolutely, absolutely. And to that end, I'm actually, before we get off, I'm going to put a link in our chat for the web page where you can get the information on the RFA. I sent everybody a draft of the RFP, excuse me. But I'm also going to send you, I'm going to put it in the chat, but at the end of the session, I'll also email it to you. So you'll have it a couple of ways where you can go to the actual web page, where you can download the RFP, including the templates. And then you'll have my email. but also on that page, it'll be where you'll upload your final proposals with important dates. So I said all of that to say what I was trying to say is you're going to have my email. I should have started with that.
Does anyone have any questions?
I don't right this minute, but I know I will. Because, you know, it has been some very valuable information, and I feel like I, you know, have to take time to digest and put it all together. But we'll definitely. I appreciate the links and the information, Veronica, that you said you'll be sending out. Because you know, we'll definitely be. I know I personally will be definitely reaching out. To work on.
Absolutely. And that's for
Thank you
everybody,
all.
Paulette. Yes. And in fact, that's why we're here. You know, we want people who apply to have success with developing a proposal, success with hopefully obtaining an award. We're doing this technical assistance across, and you don't usually have that, but across this opportunity. So please, please, please feel free to take advantage of it because we want this to be a successful experience for you. And even if you decide